Well, good morning, Abby Pensack. How are you?
I'm good, David. How are you doing?
Doing wonderful. Thank you
Good.
once again for joining me and just talking about some different things. Today, we're going to discuss long-term care. So I've got a few good questions I think I want to ask you today.
All righty.
So Abby is an independent insurance specialist, and I think this time we're going to go and we're going to give Abby a chance to give us some of your background. How about that, Abby?
That would be fine. Um, well, I started doing long-term care insurance because I had a long-term care experience with my family. So that was easy. And then as my business grew, I started to sell life insurance because there are now long-term care plans that include life insurance. So that came naturally. Then I saw there was a need for disability insurance with my clients, so I started selling disability. And then the other one is Medicare supplements, because for people that don't know insurance, it scares the daylights out of them because you're
Mhm.
going to a government website on something that's very important and very time sensitive, and so it's really great to be able to navigate people through that too. So it's long-term care, life, disability, and Medicare supplements.
Yeah. I would imagine the Medicare would really be difficult because now you're talking about somebody and hey, I'm getting older too. So we're all hopefully we'll get there one day. But when you start thinking about getting older like that, a lot of older people don't use a computer or a phone or anything to even navigate the web.
Oh yeah, you have to go into socialsecurity.gov to get SSA.gov to get started, which is counterintuitive. You would think you go to Medicare.gov, you got to get this and that, and your ducks in a row. I do a lot of hand holding.
There you go. I'm sure. Well, Abby, today's conversation is really going to be about more about long-term care. But
Hmm.
once you said something about the Medicare, let me bring that up really quick because if someone calls you and you do hold their hand and help them do what they want, is there an extra expense to them to do that, or is that just something that you do and the
That
company?
is what I provide. I do that as part of my business. And then I also provide a service to get their Part D drug plans organized. And I just do that to be nice because it helps. And also that's very complicated because you need to put in all your prescriptions, where you live, your favorite pharmacy, this and that and the other thing. And then there's tiers to different drugs, tier 1 drugs, tier 2 drugs. It's confusing for the average person. You have to really have studied it, which I
Yeah.
did, and take tests, and I did.
Yeah, I'm sure because as much information, is out there. I mean, who wants to be an expert on that unless you're selling it like yourself?
Well, the thing too is that once you turn 64, you get about a piece of mail every other day
Hmm.
who somebody's selling something. Humana's trying to sell Humana, and United Healthcare is trying to sell them, and so they're not objective. And then you see a zillion things on TV. If you watch TV, you've got Joe Namath telling you about what he thinks you should do. You don't want to listen to those folks. You want to listen to a trusted advisor who has your best interest.
Right. So not a Google advisor. Is that what you're
Not a
telling me?
Google advisor, not, and don't, they make a joke about don't go to WebMD to find out your diagnosis.
Right.
Right, that's right.
Okay. Well, Matt, Abby, one of the first questions I had for you is uh, as far as facilities, what are the odds for, or let me say it like this. Why does it seem like most people are going to facilities like long-term care facilities versus at-home care? Why?
Well, some of it is because if they had long-term care insurance policies that are, let's say they're 80 years old now and they bought their policy 40 years ago, a lot of them were just nursing home policies. So the public actually has a preconceived idea that long-term care, extended care is nursing home. It's not. And most people want to be home. They're happy at home. Generally speaking, nobody wants to go to a nursing home. I have not had any clients ever who said, I want to go to a nursing home. I don't want to stay home. None. zero.
I
And the other thing is if you don't have long-term care insurance and you run out of money, which you can, if you're on Medicaid, that's the only thing you have, and you can't pick the place you want to go to because it's really hard. So you want having a robust long-term care plan in this era is the best way to protect your money and, most important, protect your freedom. Really, you can
right.
do. I mean, you can do what you want.
Right. Abby, a few weeks ago, I interviewed Susan Miller Timmons. She was a care provider for both her mom and her dad.
Hmm.
And you know what? Just hearing her story was really heartbreaking because, you think about if that is your mom or dad or a loved one and you're having to do it, it could be a spouse, could be anybody that you're a caregiver for. And you know what? Out of the very end part, what I really took out of that is because her parents didn't know about long-term care insurance, they
Hmm.
didn't have it. When she told me the cost of what they were having to pay
Oh yeah.
for every month, like $6,000, $7,000 a month,
Uh-huh.
she tells me that she honestly thinks that her dad, they were both in the same time. The dad was helping take care of the mother. Susan was taking care of both of them. But the dad got down, and she really thinks it was a mental thing because
Oh God,
he
yeah.
knew that he could not pay that $7,000 a month or whatever it was for that. And she thinks that he had a nervous breakdown, and that's what he died for.
That
From.
is cookbook. If you do want to Google something, Google the stress on caregivers. The stress on caregivers is immense. They get sick, they die, sadly. If you've got an 85-year-old mom and a 90-year-old dad, dad can't get mom off and on the toilet, nor does mom want him to do
Right,
that. And
right,
you want to keep your dignity. Uh, and what if both? Yeah, it's a train wreck.
right. Well, she was also driving hours each time, each way. And every time something, happened,
Happened. Phone call in
yeah,
the middle of the night.
that's
Yep.
right. She was jump in her car and, boogie it down to Nashville to do that. And it's just really, really a sad thing. I think she did an awesome job from what I heard, that she talked about. And I think she was very, in some ways, fortunate to be able to be that person that
Hmm.
took care of her mom and dad. But in the other ways, you see that, and I'm sure it's tough.
It's very tough. And it also affects families. So let's say your friend is taking up her life and she can't attend to her children, or she gets a call in the middle of the afternoon at her job, or her husband is not thrilled that she's spending 30 hours at her folks' house every week.
Right.
So or her siblings aren't helping. So all those things affect the family dynamics.
Hmm.
So it's not good on any level.
Right.
But you can pay your family through different types of long-term care plans. And with COVID-19 and all the horror you see in the news about so many deaths and all this horrible stuff, and uh, you can see why people don't want to go to a facility. I mean, some folks have to. They're really so debilitated, or if they have memory care, although you can have someone 24 hours a day. But, with COVID now, it's frightening. It's frightening. When you send your folks in, they're 14 days quarantined in a room. And if they've got a little dementia or a little cognitive issue, they get scared. They can't see anybody. It's not great. So this is the time to stay home.
Yeah, with that being said, I've actually got a friend that his father went into a facility right before the COVID. He was visiting, they were having good times. He was seeing them, he'd, you know, laugh and joke.
Hmm.
When COVID-19 came around, they shut the facilities down and
Right.
no one could enter except for
No.
staff. So he literally didn't see his dad for a month and a half. And unfortunately, his dad passed away while they were on lockdown and he
Oh,
was
that's
unable to see
terrible.
him.
That's terrible. Nor can the residents leave. Just because you're in an assisted living doesn't mean, they have these great buses that take you out to go to the market or go to a movie.
Right.
These folks are stuck in their rooms. They get their meals served at their door. No more meals, so
Right.
their socialization is down. Yep.
Well, yeah, it really is sad. Well, Abby, I guess the last question I've got is, you mentioned about family taking care of family and stuff like
Uh-huh.
that. How much are you seeing that now? And like, do people even really realize that, what you can have somebody take care of if if your parents need 24/7 care, okay, but
Uh-huh.
maybe a family member says, what, I can do it for so many hours, and then I'm going
Hmm.
to get a break, and then somebody
Right.
else professional can come in and do that.
Right. Well, that's the thing, like the old school policies, which on occasion, not often, but on occasion were strictly nursing home policies. Now they have new policies that are indemnity policies, which, there's an old saying that cash is king. So what the indemnity policy is it does not reimburse you for service. It just reimburses you. So if you have a $5,000 a month benefit, and you stay home, you got $5,000 that you don't have to like nickel and dime. So and so came in. You have to use an agency, which costs more. So when you get cash, you have complete freedom. You can pay your kids, you can pay your husband, you can pay anybody to come do your laundry, do your groceries, all the things that long-term care does.
Right.
But you've got the cash, and
Yeah.
if you've got the cash, your your pile of money, because you accumulate a monthly benefit and then you have a pool of money, is how we put together a long-term plan. You oftentimes your money will last much longer. So if you've got a plan that's supposed to cover 3 years, it'll cover 4 or 5 years because you're in control of it and you don't need to use an agency.
Well, that's awesome because a lot of people, naturally, mom and dad have issues. You're going to take care of them regardless if you make a penny or not. But you know what? Wouldn't it really take the stress off? Say if you have a position or a job where you're like, you know what, I'm going to take some time off. I'm going to spend the last, whatever time mom and dad have, I'm going to
Hmm.
spend time with them and take care of them and not have to worry about it's a financial burden on you as well.
You can fly your kids in. Let's say I'm in Colorado, my kids are in New York. I'm 90 years old. I'm at home. I want to see my kids. They're going to help me because there's nothing like your own family with
Right,
you.
right.
Um, I just pay for their plane tickets. I pay for them to come out. They can stay with me for 2 weeks and take care of me. Maybe I'll let the agency go or the nurse go or
Right.
whomever. Yeah, it's really good. I mean, so it's important for you to find a good agent like me and and explore all those options. There are so many options in the marketplace, which is also why you need a trusted advisor.
Right.
These things are complicated, but for those of us in the industry who study and do continuing education and get licensed in all these different formats, those are the folks you go to, not
Yeah.
Google,
That's
not
awesome.
Wikipedia.
A good financial plan is not really worth much to a young person that doesn't have it in their mind that they have to have a plan. But as you
Right.
get older and you really start thinking about this, you really want to define or have a detailed plan on everything that's going to happen.
Absolutely. And I've got kids where their parents are getting older and they'll call me and go, what do we do? And oftentimes, well, not oftentimes, but many times, siblings will pool together and they
Mhm.
will pay for their parents' long-term care plan. Because if you've got 2 or 3 kids and they can pay the premium,
Mhm.
it's a heck of a lot better than worrying about what's going to happen to mom and dad. And also on a financial note, it saves their legacy. When my dad passed away, he didn't have very much money because he had a hemiplegic stroke. He couldn't move on one side, and he was going through hundreds of thousands of dollars. And that money was no longer making money. And
Right.
I'm glad he had it. But when he passed, there was not a lot of money for me and my brothers or to put away for my kids' college. So there's a lot to think about.
Right. Yeah. That is important. One of the things that Susan said in our conversation was she's like, it's so sad. She said, I realize they're a business. She said, but I'm telling you, the date that money was due, she said, they were calling you up, hounding you. I mean, and it was very stressful. And she
Oh
said,
yeah, it's terrible.
every
It's
month.
terrible.
So nothing
Yeah,
like the bill collector calling.
absolutely. I mean, no, they're looking at bottom lines. They're corporations. They need to make money. If they take in some Medicaid people, they need to make up for that lost revenue.
Right.
And yeah, there are horror stories where they can't pay, and those folks are sent out,
Right.
sent away.
Right.
So it's sad. I mean, it's sad to have to move in that direction because, you know, money is a big cog in a wheel of healthcare.
Right.
We know
Right.
that.
Right. Well, Abby, I think I've spent about as much time of yours I need to spend. I know you got a lot of clients out there looking for you to be calling them right now. So
Yes,
hey,
I do.
thank you once again for joining me and talking, and I appreciate your time.
Oh, no, it's my pleasure. It's a passion, and I love to talk about it. And I care very much for you. You're a doll. So thanks very much.
Thank you very much, Abby.
Okay, take care, Dave.
Okay.
Bye
Bye.
now.